Elevation training masks are fitness accessories designed to simulate high-altitude conditions during exercise. These masks restrict airflow, making it more challenging to breathe, which aims to improve respiratory muscle strength, increase lung capacity, and enhance overall cardiovascular endurance. While the effectiveness of these masks is debated, they have gained popularity among athletes seeking to maximize their training outcomes. The primary concept behind elevation training masks is based on the principle of hypoxic training, which is typically conducted at high altitudes where oxygen levels are lower. At these altitudes, the body must adapt by producing more red blood cells to improve oxygen delivery to muscles. Elevation masks attempt to mimic this environment by limiting the amount of air that can be inhaled, thus forcing the respiratory system to work harder. Proponents of elevation masks argue that the increased resistance in breathing strengthens the diaphragm and intercostal muscles, leading to more efficient and powerful breaths. This, in turn, can potentially enhance aerobic capacity and stamina. Additionally, some studies suggest that using these masks can improve an athlete's ability to tolerate high-intensity workouts by increasing lactate threshold, which delays muscle fatigue. However, the effectiveness of elevation masks is contested. Critics point out that the masks do not accurately simulate high-altitude conditions because they primarily create resistance to airflow rather than reducing oxygen concentration. True hypoxic training involves both lower oxygen levels and lower air pressure, conditions not replicated by masks. Consequently, some experts argue that the benefits of these masks are limited to respiratory muscle conditioning rather than comprehensive cardiovascular improvements. Moreover, the discomfort and potential risks associated with using elevation masks, such as dizziness, headaches, and impaired performance due to restricted breathing, raise concerns about their practicality and safety. Athletes are advised to use these masks cautiously and under professional guidance to avoid potential health issues. In conclusion, elevation training masks offer a novel approach to respiratory training and have some benefits in strengthening breathing muscles. However, their ability to replicate high-altitude conditions and significantly enhance athletic performance remains questionable. Athletes considering these masks should weigh the pros and cons carefully and consult with fitness professionals to determine their suitability for individual training goals.